It's such a fabulous view, isn't it?
Yeah.
So would this have been a greenfield site? Would it have been
Yeah, so this was actually
forest?
a hill. Yeah. It's part of a reservoir, actually. So we had to relocate the reservoir just by the law building downstairs, actually, and then, build on the side of it. Yeah. We'll give another 2 minutes and then we'll start.
Yeah, I mean, inevitably. Maybe you could suggest that people come and sit in one.
Yeah.
Not so spread out.
Yeah. Alexa and Elise, do you mind if I sort of ask you guys to sit towards the center so that, we can have
make it a bit more intimate.
Yeah.
And maybe we'll be a bit warmer.
So that's here in case you feel like you need to, In terms of discussion, I'm just wondering, should we move to, I mean, in a way we've done this part already.
Yeah. I mean, are there still people here from services?
Yeah. In fact, I think those are mainly the remaining people from services.
Why don't we kind of just see?
Yeah. So leave it to a Q&A and I'll just put these up. I'll refresh both sets of questions and see what comes up. Okay. All right, everybody, welcome back. Hope you had a scrumptious lunch and are all set to digest the next lot of information. So we've got Dr. Polly Ratcliffe from the National Addiction Centre Institute of Psychiatry, Psychology and Neuroscience at King's College London. She's a postdoc research fellow there. And she's part of a learning alliance which is funded by the ESRC on perpetration of intimate partner violence by males in substance abuse treatments, and it's a cross-cultural study. Her research has focused on gender and identity in the context of the criminal justice system, drug treatment and healthcare services. She's also acted as consultant to the Paul Hamlin Foundation Vulnerable Girls Initiative and as a special advisor to the Griffin University Research Fellowships Program for women practitioners. So really looking forward to hear Polly share her research with us today on accounting for intimate partner violence perpetration. Thank you.
Thank you, Pooja. So yes, I'm going to be talking about this ESRC, Economic and Social Research Council funded study, which is a bilateral study between England and Brazil. So the same research has gone on in parallel. And it's called the Perpetration of Intimate Partner Violence by Males and Substance Use Treatment, a Cross-Cultural Research Learning Alliance. And the idea of a learning alliance is that you have a group of stakeholders that right from the word go are involved and engaged in your research in terms of defining the kinds of research questions and the ways in which you're asking the questions, and to whom you're feeding back interim studies, interim findings at an early stage. And so that's been a very helpful part of our work, both in Brazil and in England, in London. And there are 4 components to our study. The first is to estimate and compare the prevalence of intimate partner violence by men in drug and alcohol treatment in London and Sao Paulo. The second is to qualitatively explore and compare the cultural constructs of intimate partner violence perpetration by men who have been identified as perpetrators in substance misuse treatments, in services in England and in Sao Paulo. And thirdly, to develop culturally sensitive theory around intimate partner violence perpetration amongst male substance misusers. And fourthly, to develop and disseminate a cross-culturally political framework for substance misuse staff to work with male perpetrators in the context of substance use treatment. So I'm going to talk now about the second component of the study, which is to the qualitative research with men in drug and alcohol treatment in England and Brazil. This work in Brazil has been conducted by Ana Flávia Oliveira at the University of Sao Paulo and Wagner Figueiredo also in Sao Paulo, so a different university. So the study is occasioned by our knowledge of the high prevalence amongst men in drug and alcohol treatment of intimate partner violence perpetration. We know that that men in the treatment population have around 4 times higher perpetration rates than men in the general population. And similarly, women in drug treatment, studies have found experience intimate partner violence victimization at rates between different studies, there's a range, but between 41 to 80% of general population estimates. So this is the problem that's occasioned the study. And although intimate partner violence occurs in all countries and cultures and across all ethnic groups, there is recognition of difference and variability in meanings and in perceptions of intimate partner violence perpetration across cultural and national contexts. And it's argued that cultural specific characteristics of intimate partner violence perpetration should be considered in prevention and treatment, but not very much is known about the specific underpinnings of cultural underpinnings of intimate partner violence perpetration. So looking at the different policy responses to domestic violence and abuse in both the England and Wales and Brazil context. In England and Wales, we have the call to end violence against women and girls strategy, which was launched by the UK coalition government in 2010. And the definition in that strategy of domestic violence is any incident or pattern of incidents of controlling, coercive or threatening behaviour, violence or abuse between those aged 16 or over who are or have been intimate partners or family members, regardless of gender or sexuality. So the definition of domestic violence includes intimate partner violence here. And I'm talking just about intimate partner violence, so not the sort of the violence that's been described this morning amongst by in-laws or by employers. So I think an important thing to say about domestic violence and abuse more generally is that it's, even in the UK where we have structures in place and a relatively developed system to address the protection of victims and to hold perpetrators to account, it's been fairly recently identified and defined, really since the 1970s. And that definition and recognition has been made possible by campaigning and lobbying and activism by feminists from the 1970s. And the sort of place that we are with the kind of statutory and legislative and social and service provision in the UK is really as a result of the kind of integration of those sort of feminist ideas and thoughts in the UK policy process and agenda. And so we have the legal measures that we have in England and Wales are very similar, I think, to those in Hong Kong. We don't have a separate offence for domestic violence in England and Welsh law. Intimate partner violence can be prosecuted in a number of different crimes: murder, rape, and manslaughter, assault, harassment, and threatening behaviour. And in civil law, we have a number of different measures, including occupation orders and non-molestation orders. And in both criminal and civil law cases, men can be referred to either by illegal order or by recommendation to attend perpetrator programs, treatment programs that are run both by the probation service and in the voluntary sector by voluntary sector organisations. And so some of those services men can also self-refer. In Brazil, the policy and legal measures have really been developed since 1985. They have the DDM services, protective services for women, which are they're called women's police stations, staffed by women police officers and focused on investigating and prosecuting crimes committed against women, especially sexual violence and intimate partner violence. And now there are 449 of these services across Brazil. They also have the Maria da Penha law, which came into place in 2006. Maria da Penha was a woman whose husband first tried to shoot her and then tried to electrocute her in 1983, leading her to become paraplegic, very disabled. And the legislation, the Maria da Penha law, this law 113340, was actually created after the Court of Human Rights criticised the Brazilian government for failing to have taken an effective measure to prosecute and convict particularly the husband of Maria da Penha, but more generally perpetrators, and for failing to have any recourse to address perpetration of intimate partner violence. So I think earlier in the week we've talked about one approach in addressing criticism of state practice in Hong Kong is to shame governments, and that's effectively what happened with the Brazilian government with the Court of Human Rights measure there. And as well as systems for reporting and crimes and investigating intimate partner violence crimes against women, there are also services for male perpetrators of intimate partner violence in Brazil, mainly which are referred by a judge, but there's also a small a number of services to which men can also self-refer. And the focus of the services for perpetrators is holding men accountable, that it's not considered to be in any way health treatment for men, and that there's an emphasis made on that. So as I said, the aim of my bit of the study has been to explore qualitatively the cultural constructs of intimate partner violence perpetration by substance users in England. And I carried out most of the 20 interviews that we did in London and the South East with men in treatment services who we'd previously identified as being perpetrators or having been in their lifetime, been perpetrators of intimate partner violence. So we recruited them through community drug services in London and the South East. And we included a range of men of different ages and types of substance misuse, and also different types of violence. And we used semi-structured interviews to explore their attitudes towards men and women's relationships, to hear about their direct experiences of both being victims of and also perpetrating violence in their relationships. And we were interested in how they explained that and how it fitted in their view, to their substance use. And the interviews lasted between 45 minutes and 90 minutes, and we digitally recorded them and had them transcribed and then anonymised them. And in terms of sharing our data with the Brazilian team, we translated some of a sample of our interviews. They translated a sample of their interviews, and we coded the data together, and then they pulled out the bits of their interview data that they felt were particularly relevant to the codes that we were focusing on. So we were interested in how the accounts, the stories of perpetrating intimate partner violence were authorised, and what sorts of explanations were given for intimate partner violence. And so we've talked this morning about a different way of talking about culture, and in this study, when we're thinking about culture, we're thinking of in the first instance in the sort of ways in which common sense cultural knowledge frames people's understandings of the world and of their own behaviour. And so here are some of the common sense cultural categories that men presented in the interviews, which kind of illustrate their kind of their sort of views on gender differences, their ideas about men and women's attitudes towards substances, their views on masculinity, and on equality between men and women. So for the first one, here's quite just an illustration. One of the English interviewees says, "I suppose it's the women that does everything, the woman that does everything, and the man's just the law, isn't he?" So he was just saying that about men and women's relationship within the home. Women do all the sort of housework, they take care of the children, but it's the man who has the final say about decisions and takes any role in disciplining the children. An idea that one of the Brazilian interviewees said, "No woman likes it when a man drinks." So these are kind of sort of maxims that they came out with during the interviews, which kind of illustrated sort of key ideas about men and women's relationships. There's a UK interviewee here. "I'm old school. I'm like, I should go out to work and provide for you. Not that I want," he's saying, "not that I want, because you'll go out to work and do what you want to, but I've still got to put food on the table, buy you your clothes, buy you nice things." So he's presenting himself as a provider. There's interesting heterogeneity. So here is an example again from a Brazilian interview. We would have expected it actually at the start of the study that the Brazilian men would have had much more kind of stereotypically traditional ideas about men and women's roles, but here you have a man who talks about having quite equal gender division of labour within the home. It's equal rights. I work, she works, I do the dishes, I sweep the floor. So there was quite a lot of heterogeneity. So these sorts of extracts kind of exemplify more and less kind of stable, more and less contradictory, common sense categories of masculinity that seemed to us to frame accounts and make relevant the sort of gendered identity to which these men were subscribing. So we were interested in how they told their stories, what kinds of narratives they gave us of perpetrating intimate partner violence. And it's a kind of a well-established finding in social sciences, really since 1940, when C. Wright Mills talked about the vocabulary of motives that wrongdoers deploy. Wrongdoers are found to use linguistic devices to kind of disavow their deviance. And these include minimizing, justifying, denying a wrongdoing, really in a way that makes it possible to demonstrate their allegiance to kind of normative values. And so perpetrators of intimate partner violence, of domestic violence, are not alone in using these kinds of techniques. It's been observed, in sort of feminist social sciences that that's what men do. They're just, they're giving excuses. But it's not just intimate partner violence perpetrators that do that. We know that we all, in fact, give the sorts of accounts which attempt to, although describe our understanding of something being deviant, and by doing so we minimise, justify, and deny in order to demonstrate our shared normative values. And what was interesting in terms of looking at these different interview accounts is that despite very different national and cultural contexts of the UK and Brazil, English and Brazilian men used very similar linguistic devices in their accounts. So in terms of minimising violence, they really minimised the effects, the extent of their violence, and they emphasised the limits to which the control that they used to limit the sorts of violence they used. So I've never actually used a closed fist with her. Like I said, in the 10 years, I hit her about 4 times, but she's hit me just as much as I've hit her. So who's to blame? And so this is an interesting account of asymmetry in the relationship, even though we know that violence by men to women is far from symmetrical, that women's injuries are far worse, and that sexual violence and homicide of women is far greater than the other way around. That was it's very common for men to present their violence as reciprocal. There's a Brazilian interviewee here. He talks about verbal disputes. It happened a couple of times, but it was light, only a light thing. So you've got things here, never a closed fist, only a light punch, some pushes and shoves. There's a third instance here. In the end, it'd be like, shut up and maybe lash out a bit. It was never a sustained attack. So here again, there's just ways in which men minimised the extent of their violence. And you can see here, he says, I have grabbed her by the throat. So when he goes on to talk about it, it seems actually much more extensive than his initial presentation would indicate. In terms of the substance use, the interviewees linked their violence to substance misuse and described it as character changing, and they described the disinhibiting effect of intoxication. So, for example, I was talking to this interviewee, telling him about the study. I've talked to you already about it. It's about relationships and how that's affected by your drug and alcohol use. And he says, yes, definitely. When you're drunk, something flicks a switch and you become violent. And again, with a Brazilian interviewee, a similar kind of account, arguments that sometimes it got physical because of the drinking. I would drink, then I'd go out, and I'd come home late, and then when I got home, there was fighting. So the alcohol and intoxication and the lifestyle that is occasioned by substance misuse is given a lot of agency in these accounts. It's difficult to see who is responsible for the violence. And violence is also linked to seeking, using, sharing drugs in drug-using relationships. Here's a description of something that happened. We'd just been out and scored. We'd just been to buy drugs. We'd been out for the evening all day. We'd just gone and got our heroin and were cooking it up. She was convinced I had more of it than she did. It just started. She was just getting in my face and I lashed out. We have similar accounts from Brazilian. When there was no money for drugs, then the woman would turn into a beast and she'd start breaking stuff in the house. So here, violence, he's talking about his partner's violence here, it's linked to the use of drugs. So just I've given you a few illustrations then of how men accounted for their violence. In both England and Wales and Brazil, there are legislative and safeguarding frameworks which both protect victims and hold perpetrators to account. And yet we still see that intoxication, seeking drugs and spending money on drugs and alcohol is used in terms of these, as in the linguistic devices that provide accounts in remarkably similar ways in these two different cultural contexts. So even where we have these frameworks of legislative and safeguarding frameworks to protect victims and hold perpetrators to account, men still find ways to minimise, justify and explain their intimate partner violence. And in terms of the challenge for practitioners is how practitioners can work to undermine these kinds of accounts and hold men accountable for their violence in a non-judgmental way. How can they ask questions in a range of healthcare settings in order to enable both intimate partner violence victims and perpetrators to seek help and have their needs met safely? And the high prevalence of intimate partner violence perpetration amongst substance misusers does suggest the need for an integrated, joined-up response that enables staff to both identify intimate partner violence perpetration and to access resources, support and referral pathways. Okay, thank you.
Great, thank you very much. We've got time for question and answers for Dr. Ratcliffe. Yes, Esther.
I was just wondering if you found that you could identify differences between people who use different types of substances at all. Because, I mean, to an extent, I did a study with alcohol, and I really just wondered whether or not there were different discourses associated.
I mean, that is one of the differences between. There isn't really heroin much used in the Brazilian cohort at all. There is, I think, a different dynamic, and I think research shows that alcohol and stimulants have a much more direct impact on violence. That violence amongst heroin users is much more around craving or around the lifestyle. And seeking, raising money for drugs and that kind of thing.
Esther?
Thank you. I was wondering about the fact that you said that the stories were quite similar between Brazil and the UK, and I wondered whether you had also recorded facial expressions and non-verbal language, so that not just the language, but the whole of the story was the same or different?
No. I mean, we digitally audio recorded, so we didn't do any more than that. That would be interesting, though, to know. Yeah.
Yes, Odie.
Yes. Your research is based on male-female relationship.
Yeah.
Did you also consider the effect of this substance abuse in same-sex partnership, and do you think it will make any difference, or will it come up with the same conclusions? And then my second question is, it seems as though that you took out the cultural aspect of your two sample population, I mean your population, when you did your survey, one in UK and one in Brazil, and so you do not consider culture an important factor in your research, is it? Or you just want to neutralize this part?
Well, on the first question, I think it'd be interesting to look at the, I probably don't think there would be much difference in same-sex accounts. I think people probably narrativize accounts in the same way, whatever sexuality. Yeah, no, it would be. No, I think we are certainly interested in culture, but what we found was the enormous similarity across culture. And I was just thinking about it this morning in terms of listening to the presentations. I mean, in general, in Sao Paulo, where most of the informants came, they were not living in. There were many homeless people, but generally they weren't living in extended families. They were living, in their one generation families, and they in lots of ways there are lots of differences. They come from there's a much more Catholic country, but what was interesting were the similarities. Undoubtedly, there are big cultural differences as well.
I have a question. I'm curious. You didn't look at women and sort of. So were there times where the perpetrators you were speaking to had partners who were also substance abusers themselves?
Yes, we didn't. We only interviewed men for this study, so we only have their accounts. So you can only imagine. Yeah, I mean that sort of limits the information. But yes, no, a number of them were in relationships with women who are also drug users, but the dynamic of is quite different. And the sorts of disputes that are described are quite different when the partner is not a substance misuser and is waiting at home, waiting for somebody to come home with funds which they've been either spending in the pub or spending on drugs.
So what's the main difference that you found? I mean, you're saying that the accounts were different. Was it that they thought about different things, or the expectations, or?
They gave accounts of the way in which substance misuse sort of disrupted family life, and kind of frustrated and disrupted the kind of gender roles, and frustrated their attempt to present themselves as providers for their family, and that was something that definitely came across, this sort of frustrated masculinity. But often with drug and alcohol users, particularly drug users, they're because of the need to raise money illicitly for illicit drugs, it becomes like work in itself. So people are very busy raising all kinds of funds, but in general, especially with heroin and crack, that becomes your priority, and it's difficult to match those for families to compete really in that setting.
Time for one last question, Alexa. Yeah. Okay.
Thank you for your presentation. One of the key findings seems to be that the men try to explain or justify their violence, whether that be through sort of normalising it or making it seem less serious than it was, or due to the substances they were taking. So it's because of the alcohol, because of the drugs. What are some recommendations that come from your research in terms of how to get men such as these to take responsibility, considering they're constantly sort of trying to find ways, I guess, to justify that behaviour?
Liz could probably answer that better than me, but I think that that is one of the challenges for people that work with perpetrators, to get under those accounts and really hold men accountable and see that, and enable them to see that they are responsible for the violence.
If I can pick up on that, not that I know all the answers, but certainly one of the ways that we would work with substance misusers is particularly not applying necessarily an addictions model, but a heavy use, would be maybe to highlight the fact that the choice to drink and take substances, bear in mind that some people are more addicted, but that heavy use, for example, of alcohol is a choice. And that knowing that violence and abuse and difficulties arise in these contexts, that, you know, basically highlight the ability to make safe choices and problematize both together, so that it's not saying you're not drinking or drinking has nothing to do with it, or it's about, you know, X or Y, but it's literally sort of saying, but this is a choice, these are chosen behaviours, and does it serve your needs, and what challenges are there, and almost like try and put it back to them. But that's moving away from the typical Duluth psychoeducational model and much more like working with kind of a motivational interviewing approach, which is kind of saying, does it help? What do you see? You know, to join them.
Right, okay, thank you so much. I'd like to now invite Dr. Anna Choi Wyman. She's an assistant professor at the Department of Social Work, University of Hong Kong. And she's also an accredited family mediator, registered social worker, and approved counselling supervisor. She's got more than 10 years of working experience as a social worker in practice in various family service settings, including at a shelter for victims of violence. And her research experience includes service evaluation, family conflict, violence, intimate partner violence, and children's disputes. And she'll be speaking to us today about male victims, or patients rather, of spousal abuse presenting in emergency departments, victim or abuser.
Thank you very much, Vijay. Thank you. Thank you very much. I think very interesting topic about this, because actually, most of the time we study about the domestic violence, IPV, intimate partner violence, we focus more on the abuse of women. And this topic, we try to find out some actually so-called male victim. Actually, this is difficult to define the topic, start from the beginning, because if I say the male victim, a lot of abusive women will say, no, they are not a male victim. And actually, I think this is a good data through this research to find out this so-called male victim, whether they are victim or they are abuser. Actually, this is for what reason we have an interest to know more about this man, what happened. I think that in Hong Kong, it's very interesting in these few years. Sometimes some newspaper contain news report. Some workers voice out for some men, they will say that they're also facing some domestic violence, they're abused by their female partner. So, but actually the social worker, the society, not to concern themselves. So I think that maybe we need to find out what happened there. So, but actually, in fact, this is not easy to find a male victim, because I know that nowadays, even the service, a lot of service for the man in IPV is a man perpetrator. But in Hong Kong, we have a number of educational programs surrounded by social welfare department, run by NGO for the man perpetrator. In the same time, some NGO, because I closely work with one NGO, and also the social welfare department also have this kind of a perpetrator program, the educational program. They will say that nowadays very interesting, not just only men, because this perpetrator program not just only for men, but also for women. So through the promotion, the referrals from some family service center, they will find that, I'm not sure, because I'm not sure the accurate number, okay? But according to one NGO, so just share with me that 1/3, okay? 1/3 cases of perpetrators is a woman. But in this program, actually it's interesting. For women, they are willing to voice out they want to have a service because I abuse my partner. It's a comparative, it's a very different to the man perpetrator. I think maybe some practitioner here, social worker or a psychiatrist or lawyer, is very interesting when we work with a man perpetrator. The first response say that, no, I don't want to abuse her, just Sue provoked me or something. Maybe just only Sue do something, so this is to do something, so this is a reason I abuse or I just doing something to discipline her. But it's very interesting for the women perpetrator, or we will say that maybe they're not a perpetrator, we say this is a woman using violence against the partner. the woman willing to admit that, yes, I do violence, I do some force against my partner. I know that is not good for that. So they're willing to seek help. But actually, because there's one of my research, I'm continuing to do something, a woman using force. But now, today is good for me to share some finding in emergency department. For what reason to go to make the study here? Because I think the emergency department is a one place it's easy to identify the men, because especially when this case reported to police, and then the police go to the incident to there, and then we send the man and the woman together to the emergency department. And also the men, when they are abused by, or maybe they injured, they will go to the emergency department. So this is the reason why to go to there, to emergency department, to try to explore more about the man, patient, their victim or abuser, what is the characteristic. So this is actually in Hong Kong. I think not even we have still a number of studies during the intimate partner violence, but actually we still have a limited understanding on the characteristic of the man victim. But in fact, a lot of study will find that men can play different roles in IPV. They can be a perpetrator or maybe a victim of resistant violence during the women self-defense or part of the common violence, or maybe the victim of a violence perpetrated by women. But I think even in different roles, he may also be sent to be admitted in the emergency department just for health checking or to receive some medical treatment after the incident. So for the men, actually there's a few studies just focus on the male victim of IPV, and men generally less likely than women to seek help. Yes, I think not just only IPV, even in general family issue or family cases, we can find that in the family service center, a lot of cases is female, is a woman. Even if something happened in the family, but the first to go to seek help is a woman, not a man. So in IPV, even this is similar, that most of the seek help person is a woman, not a man. So sometimes it's not easy for us to approach men. They perceive, because I think this is one very important issue, is a kind of a cultural factor or about their face. When they seek help, they will find that they lost their face. They lost their masculinity identity. Because I'm man, I'm not a witness, I no need to help. So, but very interesting. Some research, because through some research we find that they have a similar preference rate of IP victimization for men and women. Through a study, it's a study published from the 2000 and 2010. It's a kind of a systematic review paper. We find that for the women, it's 1 in 4 women, but the men also 1 in 5 men in physical abuse experience. Okay, so whether this is a man and woman, also similarly, they also will be a victim. We can see in Hong Kong, the Social Welfare Department newly reported backdrop spousal abuse case. In Hong Kong, the Social Welfare Department, it is easy to go to this website. We can find a newly reported case. That means this case is new case. Every year, this case is a new case reported to Social Welfare Department or some NGO is a family service center. This is known as a kind of a spousal abuse case. We will report this case to this central reporting system. And then we find that the ratio between men and women, the man to female, from 2004 is 1 to 7.8. But 2014, 2014 is a 1 to 5 with men to female. According to this ratio, we find that is this really that is an increasing number of men to be a victim. In the IPV case, you can see this is some reference number here that in 2014, the total number of spousal cases are nearly 4,000 cases. It's a newly reported case. Every year this is a new cases. It doesn't mean the total number of cases. Okay. And how about the A&E? But actually in Hong Kong, accident and emergency department, we have some study also to find out the IPV. We also find that in one study, we find the man to female ratio of IPV, the victimization, is at 1 to 7. Okay, so 1 man to 7 women, the ratio is. Another study from 1997 to 2008 is 1 to 6. This is another ratio to see between the men and the women IPV patient or IPV victim. Okay, and coming, I would like to share and what I have found in my study. Actually, this study is conducted in a regional emergency department in Hong Kong, which tries to review the cases from 2010 to 2014. It's a total 5-year cases in emergency department. But actually, in today, I would like to report the case just only 2 year and 5 months, because just a preliminary analysis finding. For details, you would like to know more about this finding and also the discussion, you can go to this paper to find this outcome.